What's going on?
Not much, I actually found out I have lupus.
Oh, really?
Yeah, it's called systemic lupus or erythematosis. Erythematosis.
Yeah? What exactly is that?
It's basically systemic lupus, or sometimes people just call it regular lupus.
Mm-hmm.
But it's an autoimmune disease,
Yeah.
as well as a chronic inflammatory, which means I have things called flare-ups, which if there's certain things that, like if I go out in the sun too much, or
Oh, wow.
if I have smoking causes it to be worse, but it just causes these flare-ups, which causes rashes on my skin, and then it causes inflammation of my internal tissues, like
Oh, yeah?
parts in my heart and kidneys and lungs and stuff.
Is it generalized to certain areas, or is it just all over?
It's all over.
All over? Wow.
Yeah.
So did they got you medicine for anything like that?
Right now it's pretty mild, so they only have me, they gave me a corticosteroid, like cortisone cream, that I can put on the rashes, and then just an NSAID
Oh, cool.
to take.
Is that stuff real expensive? I mean,
that is not, later on if it gets any more severe, the anti-malarial drugs that they put you on are expensive, like Plaquenil, they're pretty,
Oh, wow, yeah.
they're pretty costly, so that gets a little in the way, but
Yeah.
right now NSAIDs and the creams are not too bad.
Yeah. How's that affecting your life right now? Is it making a big difference, or?
Well, when you have a flare-up, you're really in pain,
Mhm.
so you don't really want to do anything. You kind of just want to stay home, and so if you want to stay home, you can't work, then, that causes money to be short and stuff like that. But other than that, it's kind of just painful day to day.
Gotcha. I'm sorry, that really stinks. I kind of know where you're coming from. I got diagnosed with Parkinson's just a while back. So.
You're so young, though.
Yeah, it's kind of a genetic thing. My grandma had it, so I got it, and we kind of got diagnosed a little early, but it's starting to hit me a little bit harder. I'm kind of in between stage 2 right now.
Okay.
The stages, there's not too much difference. There's not a set time limit or anything.
Mm-hmm.
But as you go farther, you have worse symptoms.
So it's progressive.
Yeah, it is more of a progressive type. You get like vertigo type things where your room starts spinning and trouble walking, and work limitations, things like that. It just makes it kind of like where you're coming from. It's just more of a bother to do things, and you want to stay home. Has an emotional effect, things like that. So.
So does it make you depressed, to not be able to do as much?
Sometimes, yeah. I'm on some medicine as an L-DOPA. It's called Cinemet. Basically, it kind of is an antidepressant. It helps produce dopamine, which is going to kind of connect those neurological transmitters. But it kind of goes through mood swings, and it kind of does give you that depression. It's not something that's always like that, but it's almost like a bipolar almost. Yeah.
Well, how did they diagnose your Parkinson's?
Well, because I just wasn't feeling good, they did a blood test at one point, and what happened was they found out that it is a genetic one, so I did get it that way.
You won the lottery.
Yes. Woo! But other than that, I mean, it's not something that's too horrible.
Is it a blood test, or do they do
It's more of a blood test, yeah.
Okay.
They just kind of look for the genos in those. But, yeah. So, did you have limitations for your work, besides, having to do anything like that?
Not really. They just kind of, they tell you not to do so much that, you're causing your body harm. Obviously, you don't want to overdo yourself. But other than that, when your tissues are inflamed, it's kind of hard to just move around. So other than that, I mean, I can still do my day-to-day routine. But I know how you feel with the diagnosis, with the blood and the needles.
I hate needles.
That's the way they usually diagnose lupus too.
Oh, yeah?
Is there's an anti-nuclear antibodies that kind of present when you have lupus. So they have to do all that blood test too. So it's not real fun.
Yeah.
So what are some of your symptoms that you have besides the shaking?
Like the shaking, I have that kind of the bipolar kind where you kind of go through depression, and then recession. There's that vertigo, so that way the room is spinning and you can't really feel anything. You almost just lay down. You can faint because of it sometimes. It's just you forget things a lot because you're going through. You can get frustrated because when you're trying to, like, texting, I don't know how many times I have to go back and delete words because I'm shaking trying to get the right word or trying to do that. It's pain, so I get frustrated every so often, and that just kind of builds. But having to work with that.
Well, are there any, like, complications that can arise? Like, is it life-threatening?
Not so much life-threatening. It's more what happens because of the Parkinson's that can become more life-threatening. Okay. Like, I'm becoming more dependent on people because if something happens to me that I can't help myself, or I'm having an attack and I can't get to somewhere where I'm safe or something like that, that kind of makes it life-threatening.
Right.
But it doesn't have an exact effect on, it's going to make me die on 3 years or something like that. It's not so much like that. So how about yours? Is yours kind of a yearly thing, or is it more just a dependency kind of thing?
I mean, it kind of depends on how severe it gets. For some, it does, progress to where, like, it inflames their heart tissue and can cause, their heart and their lungs to become inflamed and cause disease like pericarditis or myocarditis or something or it can cause like lung diseases that can eventually lead to.
Yeah. So does it cause a lot of problems, like, for other diseases to come in, or is yours kind of? It
does. Since it lowers your body's immune system, lupus patients do have to be more careful of infection.
Oh, okay.
They can get like salmonella or like shingles a lot easier. So we do have to, like, be careful of, like, what we surround ourselves with, and, like, we have to be really careful.
And clean things over.
Yeah.
Gotcha.
Yeah. Clean food, clean surfaces, clean everything.
Speaking of food, do you have any dietary things that you have to work with or around because of that, or?
They recommend like a high omega-3 diet.
Oh, yeah?
So lots of, like, lean fats. You can't eat a lot of, like, fried foods.
Oh, okay.
But they want you to eat a lot of, like, vegetables and fruits and stuff.
So basically no comfort foods.
Basically,
So all the good food you can
low
eat.
Cholesterol, low fat, high omega-3s.
Yeah, so like fish and...
And they don't want any foods that can cause, like, a lot of, like, mucus.
Oh, okay.
Like,
so like milk and things like that, or...
What's weird is they do let you have milk. Because then you need the calcium.
Cheese,
yes, you can't have a ton of dairy.
Okay.
But they do want you to have some, and as well as a vitamin D supplement. But you can't have a lot of over-processed foods. So, like, a lot of the breads that are out right now that have a ton of sugar in them, they, like, recommend that you get more natural, like, not overly processed.
Yeah.
Because it can cause more inflammation and stuff like that.
Gotcha.
So are there any, like, precautions you have to take besides?
Well, more of situational precautions, because if, per se, I was climbing a ladder and I had a vertigo attack, I would fall down the ladder because I wouldn't have any idea where things to grab. Up is down, down is left, and right is sideways. Yeah. But, I mean, it makes it situational. If I have other people around me, they can kind of tell. You get a little bit of a warning. It's more of you start to feel it, and then it just kind of hits you a little as you go, and then it kind of resides afterwards. It does leave you with that sick feeling for a while, though. So.
That's unfortunate.
Yeah. How about yours? Do you have any flare-up type warnings, or is it kind of it all hits, or it's not?
There's certain things that can trigger a flare-up, like sunlight or excessive sunlight. You can't have a ton of.
Yeah, you said that. I'm sorry.
Yeah. UV light. So you have to cover your arms with, like, long sleeves, sunscreen, that kind of thing.
Yeah.
They do recommend that you go in and get tested for, like, osteoporosis because it can cause a lot of inflammations, and, like, it suppresses your immune system, so your bones thin real fast and stuff like that. And they really recommend that you stay up to date with like your immunizations and shots and stuff so that you can stay as healthy as possible.
Gotcha. Is it one of those where you can take all of them at the same time, or is that one that you have to go through in a long time, wait, doctor visit, wait, things like that, or?
I have doctor visits quite often,
Oh, yeah?
but other than that, but that's more to monitor and make sure everything's
Okay.
being kept under control, because since there's no cure for
Yeah.
SLE, it's more of they just control the symptoms.
Okay.
So that
So it's more of a,
to make you more comfortable.
yeah, just a comfortable thing versus
Yeah.
having to fix a problem. I gotcha.
So, multiple medications, frequent visits to my doctor, that kind of thing.
Gotcha.
Make life more comfortable.
Yeah.
So.
Cool. Well, I'll let you get back to doing what you're doing. You have a good one, okay?
You too.